First Minister, much talk among scientists that we're moving from the pandemic stage to the endemic stage. What's your assessment?
I think we're on that journey. I don't think the scientific evidence and the data would say that we are yet in a position where the pandemic has become endemic, but hopefully that will happen in the not too distant future. There will always be significant uncertainties around COVID, not least as we know from hard, bitter experience in recent months, the prospect of new variants. So we will have to be on our guard. I think the perhaps more legitimate question that we all face and are grappling with is how do we learn to live with COVID? And that's one the Scottish Government is thinking very carefully about. We plan to publish an updated strategic framework over the next few weeks. Now, sometimes when you hear people talk about learning to live with COVID, what seems to be suggested is that one morning we'll wake up and not have to worry about it anymore and not have to do anything to try to contain and control it. That's not what I mean when I say learning to live with it. Instead, what we will have to ask ourselves is what adaptations to pre-pandemic life, face coverings, for example, it might be required in the longer term to enable us to live with it with far fewer protective measures. And of course, we've already got far fewer protective measures in place than we did at the earlier stages of the pandemic.
Last week on a revised strategic framework, this is intended to set out how we might adapt in the medium to longer term to living with this virus in a way that still mitigates the harm it does, but without the kind of restrictive measures that we are all tired of and which we know do harm in other ways. Living with the virus, a phrase that we hear more and more right now, is what we all desperately want to do, but I think it is worth reflecting on what that does and does not mean. Unfortunately, it doesn't mean waking up one morning soon and finding that COVID has disappeared or that we no longer need to think at all about mitigating the harm it can do. Hopefully, we are on a path from COVID being an epidemic to it becoming endemic, in other words, existing at more manageable and consistent levels. But that's not a shift that any government anywhere can just declare or wish into being. And while it seems that the impact of the Omicron variant on individual health is milder than past variants, it is not harmless. It still causes serious illness in some and it still takes lives. This virus, to be blunt, remains a significant threat to public health. So trying to live with the virus, as we all want to do, will involve, for all countries, careful thought and possibly some difficult choices, and it involves consideration of and empathy for everyone in our society, including those who are at the highest clinical risk from COVID. We know that we cannot continually rely on restrictive measures to manage the virus because we know the harm that does, but equally we can't be indifferent to the continued risk that COVID poses to health and well-being. So we need to consider what adaptations we can make to manage those risks in a way that is much less disruptive to our lives and, of course, much less of a daily presence in our minds. So these are important issues for not just government but for all of us to consider. So as we prepare the revised framework in the days to come, we will seek to consult across Parliament and also with business organisations and other partners across society. And our aim is to publish the revised strategic framework within the next few weeks.
Back to as much normality as possible. All of us, me included, really crave that. But we need to recognise that this virus, although we hope Omicron is milder than previous variants, this virus still takes lives and it still causes significant health impacts for people. So we've got to treat it seriously and not underestimate the damage that it can do.
Well, so, if you weren't already aware about what the big brain bullcut had said midweek regarding living with COVID, then you are now, courtesy of around about 3 minutes of insufferable shite. She really is just insufferable. You know, New Year, same shit, as they say. Obviously, the elephant in the room is the redefined version of learning to live with the coof, which I'll come on to in just a second, but there was something else that I found relatively irritating about what Thin Lips said, and not just the STV interview, but the announcements that she brought forward the day after in Holyrood. And that was about using the fact that Omicron, which is a word I detest at this point, using the fact that Omicron is a mild variant, using the fact that Omicron didn't really live up to the projections that were put out, the fear porn projections, because of it being a mild variant. Thin Lips, surprise, surprise, has now managed to say that the reason it didn't live up to the hype, so to speak, is because of people's behaviour, the rules, and boosters. And vaccines in general. Of course, you know. Again, taking credit. Again, trying to insinuate that the rules, the restrictions and whatnot that they put in place actually make a blind bit of fucking difference. when they quite clearly don't, when we just look at the fact that for the longest time during this so-called outbreak, this wave, if you will, Wales had more cases than England, yet Wales has relatively similar restrictions and rules in place to that of Scotland. yeah, you know. But it reminds me exactly of last year when Thin Lips came out and said just around about after the flu season came to an end, winter, and the coof sort of dissipated. It might have been 2020 actually. The first year that this shit started anyway. I'm starting to lose track of time. She came out at some point during that year, before the second winter season came into effect, and implied that Scotland had nearly completely eradicated COVID, again insinuating that it was the rules and whatnot that were responsible for that. Nah, it's a winter virus, pal. Quite clearly a winter virus. That's why every single winter there seems to be a new spike, But it's all part of the game, is it not? It's all about implying that the rules work, which in turn takes us full circle to the point regarding learning to live with the coof, but a redefined version. As we apparently can't just wake up one day and forget that it exists and go about our days. Oh, no. We have to have some things. We need to make amendments to the pre-COVID life. Or adapt. We should adapt some things from our pre-COVID lives. Such as face masks, is what she said, as an example. Another thing that doesn't work, but So, what this is essentially going to entail, granted it's a bit too early to speculate, but obviously there's going to be some things in place. Obviously, things maybe potentially such as face masks are going to continue, and we have to pretend that they fucking work. But they have to do this. They have to insinuate that the rules work in order for them to continue to have some semblance of rules, irrespective of whether or not they're severe or relatively minor. Gives them an excuse to keep the rules in place all year round, like they did last year with the tier system. The tier system remained in place all year round. Despite the fact we were all in the lowest tier for the longest time, the tier system was still there because why? The tier system works. Now, learning to live with the coof. Now, ordinarily, that would be exactly what she's saying we can't do. And that would be one day just waking up with no rules, no restrictions, and going about our lives. Which we should have been doing from day dot to begin with if this was all real. Now, that's not to suggest some people out there believe that the coof is real in some shape or form, others believe it's not. It's not really my place to say at this point. I don't really give a shit what you believe. But the point remains the same, that ordinarily people would have been left to their own devices to take responsibility for themselves, assess the danger, assess the situation, and go about their lives accordingly. But from the very moment this all started, we've had these fucking rules, whether it's lockdowns, or whether it's podium speeches, whether it's tier systems, whether it's mandatory masks, whether it's a plethora of retarded rules that don't make any sense. Can't go to more than 4 people's houses, but you can go to 3, 2 metre distance, then 1 metre distance, etc, etc, etc. We've been bombarded with this shit for nearly 2.5 years, and they have constantly made out and insinuated that these rules work. No proof that they fucking work. All you need to do is look at parts of the world where they've had extremely stringent rules and measures in place. Tends to be the case that they have more cases than parts of the world that have a lot less restrictions and rules in place. It's very strange how that seems to work. But it's always been about implying that the rules work. Always been about implying that the measures work, because it justifies prolonging them. So when Thin Lips talks about learning to live with the coof, but we will need to keep some things in place, not only is that bullshit, it's bullshit for a semblance of reasons. First and foremost, that would imply that the rules that will be kept over or passed over into this period where we learn to live with it, that they work when they don't. The assumption, the implication is that they work currently. They fucking don't. They clearly do not work. Second of all, of course, though, it gives her an excuse, even though she's just a puppet. It gives them all excuses to continue this shit. It gives them all excuses to keep some semblance of control over us, to prolong the so-called emergency. You know? It's just total nonsense. How can you learn to live with something if you're still putting measures in place to apparently stop the spread and whatnot? It really is just getting fucking tiresome at this point. Not that I really pay much attention to it to begin with, or in the first place, but it is just tiresome how the assumption is that the shit works. She takes credit, she praises the public for their behaviour and whatnot. None of this crap works. None of it works. And obviously, she goes on to talk about, which in one of the clips I played at the start of the video, she goes on to talk about that, you know, this can, just because it's a mild variant, it can still be dangerous to some people, etc. So it's the fucking flu. You know, all these people have done is they have taken the flu, essentially, and they have highlighted all the things that could be said about the flu, but they've done it with the coof instead. Such as it can be deadly, such as it can be passed on, such as it's contagious. Then they highlight things such as passing on the virus, you know, touching surfaces, etc. You can pass on any disease doing that. It's not new. It's not fucking a revelation. They say shit all the time like, you might not be affected by it, but you could pass it on to somebody who is. And this is the way that they try to guilt trip people into taking the boosters and the vaccinations, etc. They try to insinuate that just because you're fine, you could pass it on to somebody who's vulnerable. You could do that with literally any virus. Why is this different? And they seem to negate telling you things such as the people that tend to fall seriously ill to this virus or die. That's people in their 70s and 80s, for the most part. People with more than one or two comorbidities. You know? Overweight people, people with health issues. It's not healthy people. It's exactly the same as the flu. Arguably less dangerous than the fucking flu. Have people forgotten the flu? And as for this Omicron shit, this thin-lipped twat is still harping on about the fact that we're not sure. You know, we hope that it's a mild variant. I mean, for fuck's sake. It's just relentless crap from this boot. It really is. It's pathetic. As long as she can feign some semblance of ignorance and pretend that there's still a possibility that it's not mild, she can continue to justify this shit. It's just fucking relentless, pardon my French.
Very, very challenging situation with Omicron, as many countries across the world are. That challenge is particularly acute for the National Health Service. But I'd say two things in addition to that, and I'll flesh this out hopefully to Parliament tomorrow. Firstly, but for the protective measures we introduced before Christmas and but for the very responsible behaviour of the public, I think we would be in an even more challenging situation right now than we are, and some of our projections pre-Christmas have not quite come to pass because we've managed, I think, to mitigate to some extent what the Omicron wave would otherwise.
See? She does this in the STV interviews, she does it in Parliament as well, several times in fact. Implies that it was down to the restrictions and down to people's behaviour that we managed to mitigate the full effects of the big bad Omicron variants. Implying, of course, that the rules work, implying, of course, that restrictions work, and assuming that the vast majority of people actually follow your shit at this point. Not to mention, of course, the fact that the rules she's talking about, is it here? Aye. This was the rules that were put in place at the end of last year, where it was there are a capacity limit on large events, excluding places of worship. Adult non-professional contact sports are not allowed in indoor spaces. There must be at least a 1 metre distance between groups of up to 3 households, because, you know, 4 is very dangerous. 4 households is dangerous. But people from 3 households, that's fine. You know, in all outdoor and outdoor hospitality and leisure settings, table service is needed where alcohol is served for consumption on the premises, and nightclubs must close. They have an option of staying open without dancing, but table service and 1 metre distance between groups need to be in place. So because of nightclubs being closed during New Year and Christmas and whatnot, I wonder how many people then decided to take it upon themselves to have parties and all the rest of it in their own houses. Yeah, of course. But yeah, these are the rules that apparently mitigated the big bad Omicron variant, completely disregarding the fact that it's just a mild variant. And the reason there isn't that many hospitalisations is because it's a mild variant. But we still can't acknowledge that fact. Oh, no, can't fucking do that, can we, you bull-cut boot? Because the point is implying, lying even, and saying that the restrictions work, the rules work, and all the rest of it justifies their existence and prolonging them, which will then in turn justify including some of these in the road to living with the coof. Having to walk about with face masks and probably abide by several other daft little rules because they work, apparently. They don't work. I think that's probably the second biggest con after the fucking bullshit about the vaccines. One of the biggest cons about this whole thing has been the fact that this thin-lipped arsehole stands there, sits there, irrespective of where and when, says the same shit every single time, implies that her rules work. They don't. None of them work.
Have presented for us.
On that point, First Minister, on that point though, if we're following the same scientific advice as the UK, for example, why is Scotland always, it seems, one step different? Is it simply to be one step different?
Can I come back to that in a second?
You can. Well, another thing actually I'll say in this point, because something at the time irritated me, and it's the fact that her and Mark Drakeford, despite the fact they're just following guidance from people behind the scenes, I know that, but it's the fact that they got away with implementing more rules when England decided to kind of go the opposite way, but they played to the tune of the people that still believe in all this nonsense and still are crippled by fear. They played on their fears by implying that they're doing it for everybody's good, for the greater good, to protect the public, to protect society, etc., etc. All the time, of course, they don't work, but couldn't just say that Omicron's a mild variant. Most of the data shows that, it'll be fine. No, can't have that, because in doing so, we could risk the NHS. We could risk people dying if we did that. So we need to implement all these new rules and restrictions. It's just nonsense.
If you don't mind, because it's important, I'll complete the point I was making, which is the second thing that I hopefully will be able to give a bit more detail around tomorrow, and I will caveat this quite heavily right now, but I hope that we might be starting to see some signs of improvement in the current situation, at the very least a slowing down of the rates of increase in hospital admissions that we've been seeing in recent weeks. So challenging situation, but one that could be worse had we not taken the action we took, but also one that I hope we are starting to see signs of improvement in. Coming back to your question, John, I don't take decisions to be different from anybody. There are, I was going to say a few things. There's nothing in my time as First Minister so far that has felt a heavier weight of responsibility on my shoulders than dealing with the COVID pandemic over the past 2 years. We consider all of the decisions we make very carefully. On that point, what is the evidential basis for tougher restrictions? It's certainly in terms of figures, England seems to be broadly the same as Scotland over the piece. Why tougher restrictions here? What's the evidential basis for that? On the comparison...
Not to mention the fact, as I said, Wales had more cases at one point than England, despite the fact England didn't implement any new rules. Work that one out.
With England. If you look at the PCR daily test results, which I say I think we have to be very careful about relying on right now because of the changes in testing. If you look at the most recent day, it would suggest that cases in Scotland are falling faster than in England. But what I was going to come on to say is there are, I think the most reliable indicators that we can look at right now are twofold. Firstly, the Office of National Statistics weekly survey. Now we'll see what that says this week. Last week it said that around 1 in 20 people in Scotland had COVID versus 1 in 15 in England, which is a 30% lower level of infection in Scotland. But secondly, if we look at numbers in hospital right now, the most up-to-date figures would suggest that we have about 15% fewer people in hospital, proportionately, obviously, than in England. So I think that suggests that the actions that we are taking have been necessary. When we have rising case rates, we know the kind of things we need to do to try to stem those increases. It's about restricting crowded environments, about limiting the ways in which people come together.
But on that particular point then, you have the comparison of football grounds being limited to a crowd of 500, no limits on shopping centres, which are indoors. Again, what's the evidential basis for that?
Well,
the reason I let this all play out there is because you have to hear this. You have to hear this shit. She doesn't really have a valid explanation to kind of separate the two. Supermarkets and football stadiums, for example.
Again, I set that out quite clearly when I introduced that. So we know that people coming together at big events, it's not just about, particularly with Omicron, and this is an important point, some of the evidence suggests that these big events can potentially be super spreading events. But it's also about when you have a big event with tens of thousands of people in the one place at the one time, the travelling to these events also increases the risk of infection because people are, perhaps sharing cars on trains and buses more than they would otherwise be.
Shopping centres as well.
But thirdly, you don't tend to have tens of thousands of people in the same shopping centre at the same time in the way.
Oh well, then it is the same comparison, or the same. You could make the argument: supermarkets, shopping centres, still large gatherings of people. And you don't even need large gatherings of people. You only need 2 people, one person that's carrying the virus, in order to spread it onto somebody else. It doesn't really matter how many additional people are in the vicinity. She can't answer that.
You would in a football or a rugby stadium, for example, but big events also...
Yeah, but there's still several hundred people in a shopping centre and there's still about 100, 200 people in a supermarket, so what's the fucking difference?
Put a pressure on our emergency services. So a big football match demands police time, it demands the time of ambulance services, for example. Now these services, because of the wider impacts of the virus, are already under significant pressure. So that was also another
lie, because the vast majority of NHS services in Scotland were struggling prior to the so-called virus, but then Lips doing what the SNP do best, and that is of course pinning all the blame, passing the buck on the virus itself.
Reason for a period limiting these events. We don't want these things to be in place for any longer than necessary, which is why we will be looking at how we can start, I hope, in the not too distant future to lift these protective measures.
Lift these protective measures, and it will all coincide as we ease out of the winter period into the warmer months, and then she'll take credit again for the rules, and then we will head into the winter period again, and the whole thing will start again.
And get these kinds of things back to normal.
Over the past 5 years, the number of hospital beds have fallen by more than 2,000. Do you regret that your government
I expect to confirm further dates next week. However, I can confirm today that the attendance limit of 500 at large-scale outdoor events will be lifted from Monday at 17th January. That means, for example, that spectators will be permitted again at major outdoor sporting events, including football fixtures scheduled for early next week and the forthcoming Six Nations rugby matches. The COVID certification scheme will remain in place for these and other events and venues previously covered, but with 2 important changes. Firstly, our guidance will now stipulate that the organisers of large events of 1,000 or more people should check the certification status of at least 50% of attendees, rather than the current 20%, or at least 1,000 people, whichever figure is highest. And second, from Monday, the requirement to be fully vaccinated for the purposes of COVID certification will include having a booster if the second dose was more than 4 months ago. The NHS...
And there you have it, folks. So, no longer are you considered vaccinated if you've had both doses. You now need the booster. And if you don't get the booster, not only are you classified as unvaccinated according to Thin Lips, but your little COVID vaccine passport won't work anymore. And they're also talking about extending the vaccine certificate scheme to additional facilities, companies, sectors, areas. Despite the fact they initially pulled back from implementing this a while ago because there was no proof it works. Yet more control, yet more coercion from this bull-cat-headed fucking boot, and yet people still accept this and lap it up. I don't give a shit who wrote that little script for her. The fact of the matter remains that she stands there and pretends that this is all her. Therefore, that justifies me ripping into her as much as I do, because I fucking hate her. I resent every fibre of that bitch's being. Beady-eyed little insect reading her fucking script. And people accept this. Fuck you. And I'll leave on the vaccine quip from herself before I call it quits in this video.
The third issue I want to cover is the continued importance of vaccination and in particular of booster vaccination. The programme of course continues to go exceptionally well, and Scotland as of now continues to be the most vaccinated part of the UK in terms of first, second, third and booster doses. But there are right now still too many eligible people who are not yet fully vaccinated. If you are one of them and if you have no good reason not to be vaccinated, the reality is you're putting yourself and your...
No good reason. Now, I often ponder on the thought of whether or not she appears as convincing as she does, or as convinced in the shit that she's reading, because of one of two things. She's either a very good actress, or she genuinely believes the shit that she says. And if she genuinely believes the shit that she says, then she is really fucking ignorant to what's going on around her in regards to this vaccine. First and foremost, stating the obvious here, it's an experimental vaccination. The only one it's not is that Johnson & Johnson one, if I'm not mistaken, in terms of mRNA type vaccinations. Second of all the people that have ended up with adverse reactions that never gets mentioned. Third of all, no long-term data in regards to what could happen to people years down the line, decades down the line. None of that at all. No good reason whatsoever. Not to mention the fact that even if we take the argument that the coof actually exists, there's no requirement for healthy people to get vaccinated if they don't wish to. Vaccinations used to be about taking something in order to protect yourself, but we live in some fucking backwards world now where we're taking it to protect other people. And even that in and of itself doesn't work, because you can still contract said virus, pass on said virus. And I know they tried to make the argument and imply that even if you do catch the virus while you're vaccinated, you'll get a less severe strain. You can still pass on said virus to other people. So it defeats the purpose in that respect. No good reason whatsoever. Who fucking hate her, man.
You're putting others at unnecessary risk.
You're putting others at risk, despite the fact it doesn't matter if you're vaccinated or not. And for the first 7 days, if I'm not mistaken, it's just as severe as it would be if you weren't vaccinated. Therefore, if you come into contact with somebody, I don't know the exact dating on it. I'm paraphrasing or trying to remember off the cuff, but essentially for the first several days after you contract said virus, it's just as severe as it would be if you weren't vaccinated. Therefore, coming into contact with somebody, you pass it on, blah, 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 blah. You know, you get the drill.
Latest available data, which is adjusted for age, suggests that someone who is not fully vaccinated is at least 4 times more likely to require hospital treatment than someone who has had a booster or a third dose of vaccine.
Yeah, but you don't elaborate on the ages, health issues, comorbidities, etc. No, none of that. Why the fuck would we?
So whatever age you are, getting boosted is the single most important thing you can do to protect yourself from the worst impacts of COVID, and in doing so, to help reduce pressure on the National Health Service. And even though being fully vaccinated doesn't completely eradicate anyone's risk of getting COVID, it does reduce that risk. And that also then reduces the risk of you, if you get COVID, passing it on to others. It reduces the risk because you're less likely to get COVID of passing it on to others, including those who may be more vulnerable to serious illness.
But you can still pass it on, so. And I love that bit there at the end, particularly passing it on to people who could become seriously ill with it. Again, that goes back to what I was saying at the start of the video. They're highlighting issues with the flu that weren't highlighted prior. You could pass on the flu to somebody who could in turn get sick. Fuck's sake. You can go into Tesco's any day of the week prior to COVID, touch a trolley, germs in your hand, then go wherever it is after the fact, pass those germs on to somebody else. They could then pass it on to somebody else. And before you know it, the chain of transmission has reached somebody who is vulnerable. There's no difference. The only difference is that they're shining a spotlight on it now. And it's an attempt to guilt trip you into thinking that you could potentially pass on the coof to somebody who could become seriously ill. Well, you could do that with anything. That's life.
So in short, being fully vaccinated could save your life, or it could save the life of someone you love. But the inescapable flip side of that is this. If you are choosing without good reason not to be fully vaccinated...
Without good reason again. Fucking bitch.
You're putting your own life and the lives of other people.
Oh, your own life. But again, that's personal choice. It's entirely up to people whether or not they choose to take an experimental vaccination, quote-unquote vaccination. Just the same as it's their choice whether they take the flu jab.
At unnecessary risk. So if you haven't been able to get your booster or third jab yet because you've been self-isolating, or because you tested positive in the past 28 days, or because you simply haven't got round to it yet, please do come forward now as soon as possible. And if you haven't had a first or a second dose yet, please do so without delay. Don't run the risk of later regretting, or indeed of leaving your family to regret that you didn't take the opportunity to get the protection against illness and death that vaccination does offer to all of us.